This is the Fix Your Sciatica podcast.
Light therapy is a modality that has been growing in popularity over the past couple years. And as a passive modality skeptic, as someone who was really cautious about the various different tools and technologies that have come about over the past 5 to 10 years, I took a little bit of time taking a deep dive into light therapy and just figuring out what is going on. And I'm a believer in products like these because it's non-invasive and it's also pretty natural and it's really easy to use. And rather than you listeners listening to me trying to talk about the benefits of light therapy, I actually have Bjørn Ekeberg, the CEO of recharge.health, which is actually a company that actually specializes in creating tools like this for both optimal health and potentially the pain recovery aspect. So Bjorn, thank you so much for taking the time out of your day. I know that you are out in Norway, so there's a time difference. I appreciate you being on today's episode.
Thanks for having me on, Ashley. It's great to be able to discuss this with you.
Yeah, I'm really excited to talk about this because it's something that's certainly growing in popularity. And there's a lot of, let's just say, scams that are out there. So really looking forward to breaking down a little bit more about the therapy itself, but then talking a little bit more about the products that your company is creating. But before we go into that, tell us a little bit more about yourself and how did you get to the position that you're in today?
It's a little bit similar to what you described at the outset, Ashley, in terms of my approach to now helming a company invented the first wearable red light therapy device on the market. It didn't really follow from my background originally. I haven't studied lights or anything in particular prior to this, but my background is in part philosophy of science. I did a PhD and I wrote a book about the foundations of physics, and I've always been interested in the concept of energy in the cosmos. I mean, things that are really sort of very theoretical and high flying. But I've always had an interest in how science works and being able to understand the sort of scientific paradigm and the fault lines between knowing and believing and so on. So it's something that struck a chord with me when two of my now co-founders approached me and said they discovered a lot of studies. And these two guys are like hardware specialists, like they work with electronics equipment, they'd made solar cell lamps, etc. And as part of their research on lights, they came across NASA studies, and then they came across a lot of PubMed papers showing that red light therapy, or like that near infrared light, specific wavelengths of light, have a certain effect on the body. And they were shocked by this, and they had also teamed up. They found a doctor a medical doctor, as part of our founding team, who has worked on this for 20, 30 years, like on patients, like working with lasers and LED lights and all of this stuff. And so when I was first presented this, I was skeptical like you, because it sounds like kind of an alternative bag of treatment. And I started looking more into it and started realizing that there's a lot of stuff behind it, and it has a long pedigree. It wasn't invented yesterday. And that the main reason most of us had not heard about it before, and I think still most people also where you're located have not really heard about it. It's becoming a little bit of a buzzword maybe from the margins and in. But the reason we haven't heard about it is that nobody has made it really accessible and available for people, like super easy to use and to adopt. It still has a little bit of a sounds too good to be true and falls in under this sort of alternative bag. So long story short, I switched my hat from kind of the more trying to understand more about science, and I was blown away by the sort of potential paradigm shift of this technology and this discovery, and now sort of happy to lead this invention into people's homes insofar as I can.
Awesome. What a cool journey. What I really appreciated when we just first met earlier ago, the first thing you said, to be clear, I'm not a medical doctor, but I work alongside medical doctors. But I think what's particularly strong about your background is the PhD, the philosophy of science. When pursuing your PhD, you're conducting research yourself which allows you to be even more critical of scientific research, which I really do appreciate because of the fact that in the world of pain management, which is like the majority of listeners here, they're getting served advertisements and content just trying like of the latest devices. And when you are someone who's in pain and also who's vulnerable, it's really easy to fall victim to the marketing tactics. And I remember even in my early days as a physical therapist, one of the two most common modalities I would use, and I call them passive modalities, as in like things that are being applied to you, was the use of ultrasound and electric stimulation. And it's still being used today. And what's interesting is that going through the research, like the use of ultrasound, even like low amplitude ultrasound, and it's been so many years since the last time I've used it, so I don't know remember the settings, but the research didn't support it. Like literally just going in and like listeners, and I don't know if you encourage the people around you, like when it comes to conducting the research studies behind whatever modality, I'll actually search like specifically on PubMed or Google, I'll search like ultrasound, sciatica, or like pain, and then NCBI, which is like the National Center of Archives, and actually be able to like see the different articles that are out there. And when I'm evaluating research, I'll look at one, when was it recently published, but also two, what were the subjects and what was the research quality. And that was something that I learned in my training, and you obviously have learned in your training as well. So like seeing your credentials, I was like, okay, this Bjorn is probably one of the most qualified people to actually be able to assess the effectiveness of research. And then you partner up with the clinicians that actually talk about the practical applications of it. So that's a long-winded way of me saying I appreciate everything that you're doing, and I'm glad that you brought that up. So let's move into the actual modality itself, like red light therapy, and actually the use of light. I'm going to create like a very broad term, like question. It's like, what is it? Like, tell us a little bit more about it and what the technology is behind it.
Yeah, right now, red light therapy is sort of it's a little bit of a buzzword. I mean, you probably heard about it in multiple contexts by now, as some of your listeners may have. It tends to be, it's a general term that largely refers to two types of wavelengths. One is red light, which is visible red light in the visible spectrum of light. And the other part that's covered under red light therapy, which can be a bit confusing, is near infrared light. And the whole infrared range of energy on the spectrum, if you imagine just off of the very small part of the visible spectrum that we can see in colors, there's a huge range of wavelengths that belong to the so-called infrared. It is associated with heat, with warming effects. If you've heard of or tried an infrared sauna, it tends to have a far infrared wavelength, which means the wavelength is very long and therefore it's able to penetrate into the skin. So the discovery that we made and that NASA had done before, and actually hundreds if not thousands of researchers had discovered before, is that there's something about this near infrared wavelength. So they're typically between 800 and 880 nanometers, like specifically on the spectrum. But that this is what it seems the cells are responding to. Like what the research is showing is an effect on the mitochondria in the cells. And the mitochondria are the organelles that are responsible for energy production at the cellular level. So quite literally, with a certain wavelength and dosage of light in this particular spectrum, you can stimulate the cells to produce more energy that it then uses to help itself recover from whatever it's struggling with. So that principle was already kind of there. It's really near infrared light. It's very powerful for penetrating the skin. So you can get into deep tissue. And the crux for us when we developed our device that we'll talk about a bit later is that you can put it straight on the skin, so you get maximum effectiveness of it, and you can penetrate quite deeply into muscles and tissue, like several inches in if there's no bone in the way. And so like red light specifically on the visible side is very beneficial for skin, and that's also quite well documented. Right now we're seeing a huge explosion of cosmetic applications around red light therapy. And they are very, very different. Like if you buy a red light therapy device that's for your facial like facial toning or any of these kinds of things, it's an entirely different kind of device, even though it uses the same wavelength. So I appreciate this can be easily quite confusing. And I think the category of red light therapy, to be honest, you were pointing at it in the beginning that there's a lot of sort of noise and there's a lot of big claims and there's a lot of marketing tactics. A lot of what we're seeing around red light therapy is like relatively low power, simple devices that have more cosmetic applications, and it's very rare that you see devices that are specifically, that have the power enough to actually go in and treat and relieve pain and like go to the next level. So we are sort of positioned into that more deep, concentrated red light therapy part of that overall category, I would say.
Very cool. So, in summation, it's kind of like the use of like these lights or like the wavelength of light. It's more kind of like a transfer of energy. Is that about right? And so it's like creating some sort of reaction where every and correct me if I'm wrong, Bjorn, but like everything that occurs in nature requires some sort of energy, and we can get the energy from the fuel sources that we eat. But also the energy itself can actually be is also kind of like the purest form of energy is heat that gets generated. We can measure that, right? And so I really appreciate the visualization. Like one of the things as you're describing this, like it makes me think about like, for example, plants. For example, like the plants like will use carbon dioxide and water, but they need the sunlight to actually convert that into like the sugars to grow as well. So it will actually elicit some sort of reaction. So you brought up a very interesting point when it comes to the generation of heat and penetration depth. Because in the physical therapy world, we're looking at like say hot packs and moist heat, and we're looking at heat conduction. So oftentimes we use a hot pack, and it's like moist heat would actually conduct a lot better than say dry heat, but usually those hot packs will only penetrate, I think it's only a few centimeters. So it's really mostly the superficial aspects of tissue. So it's like the skin and the blood vessels. Usually with people who are dealing with something like sciatica pain, because the nerves themselves are so deep to the muscle and so deep to the joints, when you're applying heat to an area, you're only maybe addressing the most superficial layer of skin, maybe the superficial aspects of like the most superficial nerves, and then maybe some of the muscle, but like hitting like the super deep nerves themselves, in which people who are dealing with sciatica pain are dealing with like real irritation of like the thickest nerve in our body, but it's also deep to all of our structures. We might not necessarily be able to address that specific area because of the fact that hot packs can only penetrate so deep. So it's really cool to hear, especially like the depth. I think you said it was a couple inches, in the absence of bone. Is that what you were saying? Like how deep does like the products that you create?
The estimates are between 2 to 4 inches. Depending on this is a feature of like the power of the device, the power of the output. You can't get that kind of penetration with just a very superficial type of device, or if you have a lamp or a panel and it's like at a distance from you, right? So it's quite crucial that the device is designed to be straight on the skin to be more effective. But that potential for penetration and really cellular stimulation, that sounds a bit wonky, but that's actually what happens, right? It's like when you're applying a heat pad, and to some degree the infrared lights here will give a warming effect. These are local circulatory positive effects that you can create with heat, but it's something else with the light itself that it triggers the mitochondria that actually induces a reaction in the body at the cellular level. That's what really sets this apart from many other modalities that you might want to use.
So let's talk a little bit more about like improved cellular activity in regards to, okay, the cells are excited a little bit more, the mitochondria are a little bit more active. So what are some of like the major benefits, say from like an injury pain management standpoint? I know that your website actually has a lot of research applied to various different aspects of just like health and wellness, but I was really intrigued from an injury recovery standpoint and also muscle function as well, because especially as physical therapists, not only are we focusing on like trying to facilitate healing, we're also trying to restore and improve function. So it was really exciting to see those two pieces, which I find they truly come hand in hand. So you can tell us a little bit more about what you guys have found in regards to those two departments.
Yeah, I mean, the overall, the effect that's demonstrated from this kind of technology, it tends to be musculoskeletal, right? So it works for a range of musculoskeletal conditions because that's what responds best to this light, basically. There's also a separate and very popular application for people who are hardcore into health optimization is to use it on organs and stuff where you have a lot of mitochondria. That's a sort of a side use that's popular, but I think if we stick to the musculoskeletal for now in terms of functional rehab, right? This is where a lot of our focus is. We work a lot with athletes, like athletes coming either back from recovery, rehab from an injury, or in many ways to prevent injuries in the first place by using this kind of technology. So I think there are many studies, and we show a lot of them on our site as well, but that are like peer-reviewed studies showing significant improvements in either performance or strength and so on. Like that's one aspect of it, which makes it very appealing to a lot of athletes. But the other side, which is I think really the most powerful and where we see the most users, has to do with pain relief and inflammation reduction. Right, and that feeds right into a lot of more like difficult conditions. I know you talk a lot about sciatica and work a lot with that. That's one of many types of conditions that we've devised protocols. Like our medical doctor has specialized protocols for how to use FlexBeam, our device specifically for sciatica, pain, for scoliosis, for these kinds of conditions that are a little bit more complex, and it requires you to go deep in order to treat it properly.
Fascinating. Yeah, it's exciting to see the two combinations of like performance, but then also the pain relief and recovery. I want to touch a little bit more on the athletic performance standpoint of things, because especially listeners, when you're in pain, most likely there's going to be some sort of dysfunction or improper functioning of your muscles. And the question that we as therapists and clinicians have to ask are your muscles not functioning well because of the injury, or did your injury occur because the muscles aren't functioning properly? And we could spend a whole bunch of time just trying to figure out that question, which, I mean, it is important, especially on the recovery process, but we might as well also address the function aspect as well. So if we're able to reduce your pain while also improve how you go about doing things because your muscles are stronger, it allows you to actually go about your life, allows you to just do a lot of specific activities, which also helps the recovery process. And when I think about injury recovery, injury rehab, we're focusing on improving, like really maximizing recovery while also slowly introducing stresses to build your capacity. But then if we look at the injury prevention standpoint, we're looking at trying to find the perfect balance between both recovery and stress. And when you have something like the light therapy, it allows us to improve muscular function while also allowing tissues to heal. You're having that optimal balance of things that can operate even better. And what I also appreciate, Bjorn, what you brought up was how pain relief can occur, which is through primarily inflammation reduction. I think one of the biggest terms that people see, especially during their pain recovery journey, is this concept of inflammation. And we often demonize inflammation, but inflammation is a normal process of healing, and we do need it to actually stimulate function. And so for example, the use of Advil, like NSAIDs, non-steroidal anti-inflammatory drugs, they reduce inflammation because they actually reduce the activity of inflammatory chemicals that happen in that specific. If you're taking a pill, it's like the whole body, but if you're doing like a localized injection, it's going to be a little bit more specific to the area. Steroids, on the other hand, will actually turn the genes on of the cells to start turning over and reducing the inflammation. Tell us a little bit more, and I think you probably answered this already, but from the inflammation reduction using light therapy, is there any information on like how does that work? Because technically, like we're warming things up, right? We're technically, when something's inflamed, it's already warm to begin with. But what is that process like?
It's interesting. Just the other day, I had an interview with an old professor in Norway who was one of the guys who's published about 30 of the PubMed articles online, and just going through some of the studies that he's been working on since actually in the 80s and the 90s and the early 2000s. He established in lab tests both animal studies and human studies. And we're talking peer-reviewed, double-blind, with sham devices and so on, establishing the effect of light. This was using laser and not LED, but the same kind of wavelength. In trials against inflammation reduction pharmaceuticals. So like typically like testing them against each other, and very clear evidence that light actually worked better than the pharmaceutical approach, for which he apparently got a lot of blowback after he published it from some other corners. But this is something that I think this is where the research already like several decades ago was showing a significant promise, was in this issue of inflammation specifically. Now, it's a little bit complicated to tell because there are multiple mechanisms involved, and there's it goes on underneath your skin, right? So to try to tell this, it sounds a little bit like it's sort of a textbook or a science textbook lecture, if you will. But if you think of the mitochondria as the inner driver, like when you are, if you put FlexBeam around your, let's say it's your knee, that is the aching part, bend it around, and you give it a 10-minute dose on that knee. Like at the mitochondrial level, just a cellular level, there is sort of a basic engine is being revved up, if you can use that analogy. But what it also leads to is increased circulation as an effect of this, and a loosening, the relaxation of the muscle in the area then leads to an improved oxygenation of the blood in that area. So overall, you're getting better blood flow in the general area you're treating. This you can get with a heat pad also, is what you're saying. But it's the combination of this with the mitochondrial effect that it basically triggers your system to work a little bit harder in that area you're pointing it at, and understanding that it needs more, like need to repair there a little bit more. This combination of multiple effects around the area is what seemingly gives this inflammation reduction effect that's well established.
This episode is brought to you by the Sciatica Protocol. Experience pain relief directly through your phone, anytime, anywhere. Interested in learning more? Check us out at ifixyoursciatica.com/the-sciatica-protocol.
Very cool. Yeah, so we have the improved circulation. I also love that you brought up the muscular relaxation. And usually when you're dealing with pain, there's going to be some form of muscle guarding as a way to protect that joint or that area.
Yeah, it tenses up, right? So
it tenses up, yeah. And so when a muscle tenses up, it actually requires energy for it to actually tense up, is what we call an isometric contraction. And so in order for that to happen, we need to use energy. But also there's going to be byproducts of that as well, because if you're having a muscle and you're contracting for a long period of time, really depending on what energy system that you're using, if you're going like full on sprint, you're creating more of that lactic acid type of scenario, which interesting enough, like a whole bunch of studies are actually saying that the burn that we feel isn't necessarily the formation of lactic acid. It's really more of a buffer. But the burning that we feel when we're exercising is really more the accumulation of hydrogen ions, which actually increases the acidity of the specific area. But then we transition down to like even just having like a sustained level of contraction. You're having a lot of byproducts of that cellular function. And so to have the mitochondria activate a little bit more, it allows those cells, if correct me if I'm wrong, it allows those cells to actually clear out a lot of that junk that can accumulate over time, which also with the use of light, and this is just my perception, like the use of light as compared to say like a hot pack, using light is actually much easier on the skin, because I know that when applying hot packs, we had to be very, very cautious of how many layers we were applying to the skin before, like to avoid burning of the tissues. And it wasn't just burning of the skin, it was like burning underneath. And that's something that we also have to be very cautious of when we're doing even cryotherapy. Like it's important that we're not doing a freezer burn as well. So
Yeah, I can
from what you're
imagine.
describing, it
Yeah.
seems like a little bit gentler on the skin. Is that right?
Yeah, so these are very powerful lights that are inside of each pod, but they are encased and they have fans that cool them down. So the effect when you're applying it, the feeling you have is that it's a slightly warming, tingling kind of sensation, but it never really gets hot. It would get hot if we had put in far infrared, like different parts of the spectrum, but in the near infrared range, it has only really a warming effect. So the circulatory benefits and the vasodilation, or the opening of the blood vessels and everything that comes with it, is associated with that effect from the light, not from just from heat as in itself. So in a way, it's a more effective way to do like heat circulation.
Yeah, and it's also nice because it's like even like using your device, the startup time is a lot less, right? Like when you're getting a hot pack, you have to heat it up first and then put it on, as compared to you can just put the unit on you and use it. But so let's talk about a little bit more from like a practical application standpoint. Muscular and athletic performance is going to be requiring some different parameters as compared to, say, like injury recovery and just facilitating heating. Um, Typical, like, and I'm just going to use hot packs as a comparison, right? But like typical hot pack use, it's like is usually about 10 to 15 minutes in length, and really by about like minute 8, the hot pack has actually lost a lot of its heat. And so if we're looking at from like a pain and recovery standpoint, right, we don't necessarily have to worry. Like, I mean, we can go into, if you'd like, we can go into a little bit more about like placement of, say, the therapy to like red light therapy device, but also like the dosage. Is it something along the lines of, do we set it and forget it? Do we have to modulate the intensity? Do we have to like, let's go into some of like the practical applications from like a pain management standpoint. I know that your doctor, your clinical team actually has some protocols, but from like a 1,000-foot view, what are we looking at in regards to like regular daily practice of using a tool like this?
So for those who are watching, it looks like this. It's sort of like a belt. I was on a Texan podcast too, a Texas guy who said it looks like an ammo belt. And it's sort of what is like 3 packs that you have, or 3 pods with lights, and there's a controller. We like, part of our design principle was twofold. First, straight on the skin, because it's more effective that way. There's no energy is wasted. It goes straight in and can penetrate. And secondly, make it so easy to use so that you can use it frequently, because one of the stopping blocks typically for like getting effects out of red light therapy is consistency. This is not a quick fix in most cases. For a lot of people, it helps to relieve pain right away, and for some acute injuries or acute issues, you might feel an effect right away. But for most people, it's something you have to consistently use for a while, just like you would with almost any other therapy modality. So that's why for us it was super important to create something that it's so easy to use, and you don't have to, undress in the basement in front of that special panel like every day and so on, because, after a week you maybe drop off on the motivation, and then you are not as consistent, and then you don't actually get results. So we developed it with 3 settings. I'll turn it on so I can show and you can hear what it sounds like. You just basically choose 1, 2, or 3. This depends on how deep you want to treat. So now I put to 3, which is the deepest setting that has the most near infrared. And you see the lights here, they just turn on by themselves and then off after 10 minutes. And we consider 10 minutes to be like 1 dose. You can sometimes use 20 in the same spot if you need a little bit extra. But the only reason you would want to do more than, say, 20 minutes in one session is if you have multiple areas to cover. So in a more complicated case like sciatica, for example, in our sciatica protocol, it calls for both sort of along legs and supporting in the back, so you have a few placements. But that's like half an hour max per day. And you can use this, you can wear it, right? If you're doing on the back, for example. So lots of our users, they love, you can cook for the kids while you are doing your therapy. You can use it in your car. So there's no particular reason why you have to dedicate a certain amount of time to it. But the idea of then like it's a high dose in like a powerful dose within a relatively short amount of time, then you need to rest and to recover and sleep, and then your body's a little bit better the next day, and then you use it again and so on, and you start getting results from that.
I appreciate you. Oh, sorry, go ahead.
Yeah.
I was going to say it's fantastic to hear that you said it's not a quick fix. Unfortunately, what a lot of products that are out there are talking about, oh, do this on only one use and you're going to feel like 10 times better. And it's these promises that companies market, which results in the fact that people end up getting like these false hopes and dreams when purchasing it, and only find out that it does take a little bit longer. So for us to set that realistic expectation, saying it's going to take a little bit of time, sets our expectation, allows us to also use this in conjunction of doing things a different way. And so the way that I foresee, especially in the sciatica pain spectrum, and I'm glad that you do have a protocol for that, is once we identify what the source of the pain is. It could be the fact that, listeners, your sciatica pain is the fact that your back is extremely tight and you use your back muscles a lot. And as a result, we actually need to let those back muscles relax, which ends up pinching the nerves that form the sciatic nerve a lot less. So I foresee that we would put this on the low back to actually let those low back muscles relax, and then teaching your body actually how to utilize those hips and preventing the back muscles from really kicking in. And really, I would see it serve twofold. It's like, one, relaxing the muscles, but also number two, reducing your pain a little bit so you can actually go about doing activities. Because if you're in so much pain that you can't do anything at all, then it's going to be very, very challenging to actually start slowly reintegrating activity into your life if pain is like the only thing that's stopping you. So even if being able to have a modality like this that can reduce your pain from like a 7 out of 10 down to like a 5 out of 10, so you can at least do a little bit of something, gives us an opportunity to really start implementing like recovery strategies and activity strategies to help you restore your function. And then as you transition, allows you to, instead of like trying to relax a muscle, we can use it as a way for muscle recovery or muscle activation, which is another part of the realm of what your company does as well. So I really appreciate that.
No, you're totally spot on. These positive incremental steps can actually create a virtuous cycle, right? If a little bit of extra circulation and relaxation then loosens the pain and you're able to move a little bit more, then you're getting faster to results the next day and the next day and the next day. And that was part of the idea behind it, why we designed it this way. I would say most of our users experience pain relief significantly more than just a couple of steps down on the pain scale, which is one of the reasons I think a lot of people buy it. But you're totally right in that that's often what keeps you, like, prevents you from progress, right? Is you're just literally held back by it. So we see this as a vital supplement of energy to your body for it to really do what it does best, which is to heal itself. And for myself, like, that's how when I met our Dr. Zuli Frost as part of the founding team, it's kind of what won me over from doing something that was an entirely different career path into engaging more and more into this sphere, is this realization that it's not just a product or it's a fix or it's some sort of technical thing. The whole paradigm here is about energy and your body's capacity for healing. Right, and you talked initially also about energy from plants and so on, and you said it all comes from sunlight. It's actually literally one source of energy in the whole world. For everything we know, all comes from sunlight, and it's an often neglected part of our relationship to the sun is that we also depend on it. We know that plants get their source of energy from the sun, and therefore, like, animals that eat the plants also get their energy from the sun. But we are just like plants. Like, we will fade and lilt and will not be able to perform if we don't get a certain amount of daylight sunlight straight on our skin. So the light that's in a FlexBeam, this near infrared and red light, is literally just a concentrated version of, like, a part of the spectrum that you get anyway in full daylight. So it's a more concentrated treatment that can help you when you have a specific issue. For general health purposes, it's like I advise everyone to actually get daylight and sunlight. It's like that's where you get the full range of benefits, right? But this can be a significant way to help you along that journey to get a little bit faster, move back into your old, like if it's the old way of walking or old way of being, right?
So to piggyback off of that, it is a concentrated form of what we're already getting from the sun itself. Anyway, so let's talk about the safety aspect of things, because especially out here in North America, skin cancer rates are going really are like increasing every single year. You're having schools of thought saying you need you shouldn't be wearing sunblock because it's causing cancer, and that's an entirely different conversation aside. But then also, vitamin D has a huge role in regards to how our body functions, and we get it from our exposure to sunlight. But specifically, this type of light therapy, let's talk about the safety, the safety around it in regards to areas that you would want to avoid, and then also for the folks who would not be candidates of using a device like this.
I mean, it's one of the reasons we started with this modality, because the vision of our company is that there are multiple things that can help you, like that are interesting technologies. But starting with red and near infrared light was because it was the most researched and the most clearly established to be safe for virtually everyone. There are no known side effects of the treatment. What we know of people who do too much, as in you sit for hours and you just do it, is they end up not getting an effect. There is a dosage window, it's called a biphasic dose response, which is sort of like a Goldilocks principle, is that you give your body just enough within a certain range. That's what stimulates it to bounce back stronger. Sometimes called hormetic stress response, or similar to if you do ice bathing or like cold plunging or something, you get the stress response in the cells after. Red light therapy will do that, will induce the same kind of response way, so that you can so that you bounce back. But more is not better, so that's one important part. So everyone can really use it. The only caveats that we've seen is with very, very fresh ink tattoos. People who have used it for these were like half an hour and up, straight on the hardest setting, straight on a fresh ink tattoo, that can cause a burning in the skin. Right, so that's one precaution we have. It's not recommended for terminal cancer patients, but for the only reason that there is no research on the effect one way or the other, because you cannot do research on cancer patients. For similar reasons, we don't recommend pregnant people to use it anywhere near the area or like on the belly or anything like this, also because there are no studies, because you cannot do studies. So it's not to say that it is itself unsafe, but these are precautions you have to take. And lastly, it's do not stare for a long time straight into the light. To put FlexBeam straight in front of your eyes and stare at it for a long time. It takes a lot to hurt your eyes this way, but it's one of the few things that are known that it's theoretically possible if you were to stare into it. A little bit like staring into the sun, for too long. No, on the whole, this is something that really is for everybody. In a way, it's one of the challenges we've had in trying to make people more aware of this technology, is because it sounds almost like it's just too many potential benefits and too many potential applications. But focusing a lot on the rehab, functional aspect and movement and stuff, I think that's core, because of the well-established sort of muscular skeletal improvement that can come from this kind of supplement.
Fascinating. Thank you so much for sharing that, because I don't think many devices actually talk enough about the safety mechanisms or the safety precautions behind it. And as a result, people will buy devices or products or everything like that, and then kind of put themselves in a compromised position because they might not have been a candidate in the first place. And one of the many things that I really love about light therapy is the fact that it's non-pharmacologic, as in there's no chemicals. It's not invasive at all, unless you call the couple inch penetration of light invasive. And so and it's ideally, hopefully, increase in accessibility. And so a huge fan of your work, huge fan of what the company is doing and the product. So for the listeners that are out there who are thinking, I think this is a tool that I want to implement into my own recovery process, how can they learn more, or how can they get access to your devices?
Go to our website, recharge.health. That's our company. It's called Recharge Health. We have a load of different resources if you want to dig into the studies, but also practical hands-on guides. We have a membership program for those who buy a unit that gets you into a community forum with Dr. Zulia Frost. You can ask questions, you can get support, you can get protocols, like clinical guidance on top. And of course, on recharge.health, you can buy FlexBeam, the device, straight from our shop as well. And we offer a 60-day open purchase, like money back guarantee. Like people who buy one, they tend not to return it because it is a good investment for the long term. You can use it for multiple things. Typically start off with something like if you have a particular thing you want to test it for, but it is sort of the family medicine cabinet doctor in a way. Like it's a good friend to have for a lot of different conditions.
Absolutely. And then for the listeners who have some more questions about the light therapy device, the FlexBeam, what's the best way to get more of that information?
Also on our website, and we have a fabulous support team that you can either chat directly with or email that can answer any particular concerns you might have or any questions about specific applications or any of these things. So I encourage everyone to go read more at recharge.health and check it out for yourself.
Listeners, if you did not get a chance to write that down, I actually put the link into the show notes. Bjorn, I really appreciate the time that you've taken out of your day to share your knowledge and the technology that you're bringing into this world, and really excited for all the healing that is going to be occurring. So thank you so much for your time, and listeners, definitely check out recharge.health to see if this tool can be a great fit for you.
Thank you so much, Ashley. Really appreciate what you were doing also in helping to raise awareness, and congrats.
Thank you.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.